Hello and welcome to Newswire with me, Ayza Omar. Today we are going to be taking a look at the pandemic COVID-19 as it spreads across the world and what measures are countries taking. We're hoping to also do a comparative on which countries have succeeded somewhat at least in decreasing the number of new cases coming in, decreasing the number of deaths occurring because of this. We're also going to take a look into how Pakistan has spearheaded its efforts after the number of cases has been rising since the first one came out. So without further ado, let me introduce our panel of experts. We have with us from the UK, from London, joining us, Mr. Henry Bolton. He's a politician. He'll be talking to us on how UK is going forward with its strategies. Then we also have Dr. Valerio, Alfonso, a political analyst and also a senior fellow at the Center for Analysis of the Radical Right. He is joining us from Napoli, Italy. Welcome to both of you. I want to start with you, Mr. Bolton. The situation is getting worse day by day. The number of cases are rising. Tell us a little about the UK and how it's moved forward in putting in place measures to stop the spread.
Well, I think there are two things to be said, and this is the first thing is that a significant challenge for the government on this is that the progression of the virus and the infections in the UK is not evenly spread. So the variations, for example, between the southeast of the UK and London are quite marked. And so there are different social dynamics there, different densities of population, and different behavioural styles. Different sort of social interaction, which makes government policy on this very, very tricky because it has to vary with the different areas and the progression of the disease. But what has happened is that initially the government wanted to just calm people down, but also gradually generate a feeling that there was a risk, there was a threat. Because what they wanted to do was save the sort of the most stringent measures for the time at which they felt that the virus was really in a position to explode across the population, and that would put big pressure on the healthcare services. And it's been the same problem across, I think, every country that's been deeply affected by this. So what has happened now recently is that the Prime Minister, the day before yesterday, issued an edict saying that everybody was to stay at home apart from a very small list of necessary tasks, buying necessary household items, food, this sort of thing, medicines, one exercise per day, this sort of thing. So there is an increasing ramping up of the government's approach on this to try and prevent the disease really exploding and overwhelming our healthcare services, whilst the government at the same time builds up the healthcare system. So the army has been brought in to assist. There's a 4,000-bed hospital being created in London, jointly by the Army and the National Health Service, for example. And they've just called for 250,000 volunteers to assist the National Health Service.
We'll get back to you to get more information on what else the UK is doing, but I want to get to you here, Dr. Alfonso, about the situation in Italy. It is one of the worst hit countries right after China from where the pandemic originated. 69,000 confirmed cases, nearly 7,000 dead. From your experience, tell us a little about what went wrong, if anything at all did. Why did Italy get hit so hard?
Unfortunately, this is a real issue in Italy. We cannot explain why it is so strong, the spreading of the coronavirus. Even if we implemented a quite strict lockdown, now it's 15 days. So far, the results are not there. It's true, in the last 3 days, we had a decrease in the number of deaths, but suddenly yesterday, the deaths were going up again. More than 700 people died in one single day yesterday. So we have almost 7,000 people which already died so far for the virus, which are concentrated mostly in one region of Italy, in the Lombardy. It's the region of Milano, and it's really a case. All the medical doctors, the virologists, epidemiologists, they are trying to understand why so many deaths in in this area of Italy. But so far there is no explanation. There is also we are also trying to avoid that people from this area where the virus is so been spreading so much, they go to other regions, especially in the center and the south of Italy, because in the center and the south of Italy, the hospitals are not so good. The health system is not as good as the one we have in northern Italy. So here it will be really catastrophic if we have the spreading of the virus.
We're trying to contain the spread there. Dr. Alfonso, I may interrupt here. Our hearts generally go out to those in Italy. It is horrible, the reports coming out of there. And of course, not having understood or knowing why it spread so much, it makes it worse. But there are some extraordinary measures Italy is doing. For example, there were medical students who had their final exams, 10,000 of them. Those exams have been scrapped so they can help in relieving the more senior doctors. Is that correct?
So in an attempt to try to ease the situation, to support, because the doctors and the nurses are lacking in north of Italy. Many of them are sick. Also, we are receiving help from other countries, like medical doctors and equipment from China, from Russia, from Cuba, also from some NGOs from the United States. Also, there was a call for Italian doctors from everywhere in Italy to join, so 300 doctors going to Lombardy and other regions in the north. But so far, there are not clear results. The lockdown is even more strict in the last 2 days. Many industries, companies, they shut down. Only essential ones are open. People can go out now only if really necessary, so to go to buy drugs or to buy food. And before you could go out, to run, to bring your dog outside. Today it's not really possible. Also, there are
so the measures you're saying, Dr. Alfonso, are getting more and more strict here. Mr. Bolton, to ask you about this, coming to you here, the NHS, the National Health Service, has also done something similar, hasn't it? That it's reached out to all its retired doctors to get them to help the NHS fight this.
Nearly 12,000 doctors and senior nurses, not just the junior nurses, but doctors and senior nurses who had retired have volunteered to come back into work, into the health system. And in addition, the same thing has happened here, where medical students in their last year of medical practice, or last 18 months, I think, have been asked to come forward to support the medical system. And in addition, there's the 250,000 volunteers that have been asked for to provide mainly support in the administrative side, because of course a hospital needs people running the laundry, the catering, the cleaning, the portering, and so on. It's not just the medical staff here. So those people as well, without them, the hospitals don't function. And so there is this 250,000 people, they're being called to provide that sort of support as well. So there's a mobilization, and that's what I would call it, a mobilization going on here, where part of the population is being orientated entirely to this effort, whilst the rest are being asked to stay at home, not go anywhere, not to mix. And in fact, the Prime Minister has said that meetings of more than 2 people are not to take place. And so there's a lot going on. It is a crisis that we haven't seen the like of since World War II.
Dr. Alfonso, something that we've seen, however, in Italy, in northern Italy, which has been hit the worst, is that blanket testing in a town called Vo has actually brought down the number of cases, so much so that there has been no new case since the 13th of March.
Yeah, it's true. This is a small city in the north of Italy was completely locked down. It was not possible to enter, not possible to go outside. So after 2 weeks, there were no new cases. Unfortunately, it was not possible, practically speaking, to implement this strict lockdown everywhere in Italy. So there are people still going to work. There are people who needs to go to the market to buy essential things. So this small town is like 3,000, 4,000 people. So it was easier to completely block the village. And the result.
Right. So it wasn't just the blanket testing, was it? It was also the strict routine that nobody is allowed to move, step out of their houses except for essential items, and those who are tested positive are kept in quarantine, as are their contacts. Mr. Bolton, do you think that the criticism that is coming in from all quarters, not just for UK, but also for Italy in this case, is that not much was done and it was too late by the time the government really took the right measures?
It's available. That's one problem. So we couldn't the population. But interestingly, as I understand it, the research that's come out of the situation in that town of Vo in northern Italy is that out of every 11 infected people who tested positive when they were all tested, out of every 11, 10 had no symptoms whatsoever. And there is a report now that came out from Oxford University here in the UK yesterday that suggests that actually hundreds of thousands of people in the UK are already infected. It is just that they are showing no symptoms. Now, the problem that the government has is trying to persuade people who are young and healthy and have no symptoms whatsoever that they should stay at home. They feel that they can go out, that they can do things. They feel perfectly okay, and they don't understand that they may be carrying this virus. And so they don't necessarily take precautions. So it's normally if you have the flu or something, you feel unwell, you know you're unwell, you take action. But if you feel perfectly okay, it's more difficult to impose restrictions on yourself to exercise that self-discipline. I think that's a major problem in this crisis.
It is a very disturbing report because many of these reports are coming out that there are patients, for example, from Wuhan. Doctors came out with this report recently that says that 60% of those tested positive were asymptomatic, meaning they were not showing symptoms. So, Dr. Alfonso, in such an extraordinary situation where those who are sick, who are carriers, are not showing symptoms, then blanket testing like it was done in Vo could possibly be the most effective measure at this point.
Probably in Italy we have 10 times more cases. So we are going towards 1 million if this was the case like in Vo, which many are asymptomatic. The problem, as I said earlier, is really not possible to lock down completely Italy and our cities with millions of inhabitants like we did with this small town of Vo. Because already right now there are many activities which are down. The economy has slowed down by 90%, but we need to keep the production open of food. We need to have essential services like police, hospitals. So it's not possible to close completely Italy as we did with Vo.
The economic backlash is very scary, for sure. But Mr. Alfonso, I know that the sample size of Vo was very small, but even in Singapore, in South Korea, which has actually managed to somewhat decrease the number of cases coming in, the number of deaths, what we've seen common is not just the quarantine, but blanket testing. Do you think that one of the problems this is not happening is also because maybe the availability of kits, the expense of that test itself?
Of course. We're lacking not only kits, but we're lacking even masks, all the equipment. Sometimes we have doctors in the northern region of Italy. They are forced to be in the hospital to people with the coronavirus, dealing with them and try to save them without even having the masks to protect themselves. So we have no enough kits so far. We have no masks. We have no protective gloves and other equipment, because this came as a surprise and we are lacking completely the resources, unfortunately. So I think it's really not possible to do tests everywhere like will be needed.
Mr. Bolton, what about in the UK? Is testing being given that kind of importance? As example countries have shown that it is effective in quarantine, keeping in quarantine those who are affected, who otherwise might not show symptoms.
I think it was crucial to get it out there as testing done as broadly, as widely as possible, because although I agree that locking down populations of millions of people and forcing them to stay at home and not to socialize with people is very difficult. If these people that the 60% in China and the however many percent in Italy and the UK who are infected but don't know it, if they were to know it, if they were tested and they knew that they were unwell, then I think the vast majority of them would go into self-isolation. But if they don't know that they're unwell, they feel perfectly okay, they will restrict their own movements less. And I think, so yes, I think that the answer to your question is that widespread, extensive testing at an early stage, and in fact, it's never too late, is absolutely crucial in managing this disease.
Dr. Alfonso, what are your concerns about the vaccine, when it will come, and whether it will be too late by the time it does get developed?
Well, we have news every day concerning the possibility to get a vaccine, like from Germany. They're working on it in the US. I also think in China and in Israel, there are very good news. Unfortunately, all the experts say that at least we will need 6 months to have a vaccine, because you need all the trials, clinical trials. It's not so. 6 months to up to 1 year, and unfortunately, I'm not sure if the world will be, will have so much time. So maybe we will also try to focus on drugs that can help to save lives of people, to try to have more intensive care beds. In Italy, for example, we have been forcing to prepare a new hospital to arrange with into the gym or outside the hospital to create new units with the intensive care beds, because we are lacking them. We saw in Spain a few days ago very bad situation with people lying on the floor of hospitals, which is the real problem, because we were not ready to have so many people needing intensive care beds. And that's the real problem, because the vaccine will take, I think, at least 6 months to 1 year. So at least having some drugs that can help deal with this virus.
The vaccine is going to take a long time. Mr. Bolton, let's talk about what's happening in the U.S. there. Right now, New York State, the governor says, has been hit by a bullet train. They have 25,000 confirmed cases. That's about half of the number of cases across the United States. Where was it that they went wrong, do you feel, in controlling this pandemic?
I know that on the vaccination thing, just briefly, I know that there are a lot of efforts going into looking at whether existing medicines might be able to have a role to play in this. For example, chloroquine, which I'm not a medical man, but chloroquine seems to have some effect on this. It's already trialed. It's already been in use for some 50 years. So that may be an answer as well, or a help. But yes, with regards to the United States, I think the United States is suffering from all of the problems that we've talked about and more. So, for example, testing is not widely available. The equipment is not widely available. The protective equipment for the medical personnel. The U.S. medical system is not really equipped to deal with or structured to deal with something like this, and the way that it's funded. Furthermore, they've got the different approaches that are being used by different states and different cities, so there's not a coherence in the strategy. And finally, at the federal level, at the national level, the messaging coming out of the White House has not been particularly helpful at the beginning of this crisis. There seemed to be more concern about preventing the markets from panicking than actually worrying about the seriousness of this crisis. So I think there was a political problem at the White House level. The one thing that has to happen in every country, it has to be political unanimity, and unanimity between the leading politicians and the medical people. Because it's like a war. If the soldiers don't all pull together and work towards the same aim in the same way, then they will be defeated. And it's the same with this. If you don't have coherence, if you don't have strong and unified leadership, then there is going to be a greater problem.
There is going to be a greater problem there. But Mr. Alfonso, very quickly, last question to you here. There is concern, of course, all across the world that there will be a second wave in places which have recovered pretty much, like China, like South Korea. Any concerns, any advice for countries on how to prevent that?
Yeah, this is a big issue. I fear that there will be waves. I heard that possibly during the summer the situation may calm down, but after the summer in September, October, we will have new waves. So there will be like a seasonal flu going up and down. And there really will be, every country will try to completely close its borders, will be very, very costly from an economic point of view. logistic point of view, because it's not possible to close completely a country. Of course, we are already assisting to the second wave, like in China, we have new cases. In Hong Kong, we have new cases. Also in South Korea. So I really think that once, for example, the situation will be better in Italy because of this lockdown we are implementing, that could be all vanished because of a second wave with people coming in our country. But you cannot completely isolate one country in 2020. It's not possible. And I completely agree with what Mr. Bolton had said. We have to make sure that there is just one strategy. If we want to focus on the economy, it's not possible to focus on public health and the opposite. So like Trump, what he said, he will try to save the American economy and to start again the American economy by Easter. I think it makes little sense, because by Easter there will be much more cases in the US. So if you want to care about the economy of the US, you can not reopen the lockdown in the States.
It's a big debate. It's a big debate even in Pakistan, where 1,000 cases have been confirmed of the virus. The Prime Minister announced a few days ago, we're not going to have a complete lockdown because it affects 25% of the population who lives under the poverty line. However, there were economic and financial relief packages announced for those who are on daily wages, and programs to give relief to industries who are going to be hit hard. Mr. Bolton, just curious to know, these kind of countries in South Asia who are taking measures, it seems a bit ahead of the curve. Is there something to learn from this, or something to highlight that might be used as an example elsewhere?
Yeah, I think that the difficulty is the level of a lot of people in some areas suffer quite a degree of poverty, but and the living conditions in some areas are difficult. But the answer is to address the things that we've been talking about, ensure that widespread testing is out there, that public awareness is really powerfully communicated, so that people are really aware that this isn't just a bad cold or flu. This is a killer, and it is different to other ones. So that work has to start as early as possible. And if it didn't start yesterday, start it today. But if I may, I'd just like to point to two other issues which we've not touched on. One is that there are some glimmers of hope. Earlier we said that there's a large proportion of the population that we believe is infected, but that's asymptomatic, not suffering symptoms. And have these people got immunity now? Is there a resilience being built up in the population that will give us a hope going forward? I think that's a very interesting question. And the second thing, we've got to start looking forward as to where these diseases came from. And I don't mean geographically, but I mean in terms of, think about it, swine flu came from Mexico, bird flu. Now we've got a flu that's supposedly originated in a live market with wild animals in China. There is a serious issue about the way that we treat animals and some of the ways that animals enter the human food chain. And we really need to address this, because we are getting waves of these, and they are getting successively more serious. And our immunity, I would imagine, again, I'm not a medical person, is being undermined by them.
Right. Undermined by. That's an interesting point indeed. Unfortunately, we've run out of time here. Mr. Bolton and Dr. Alfonso, thank you so much for joining us in this conversation. We'll take a quick short break. We'll be right back. Welcome back to Newswire. I'm Ayza Omar. We'll talk a little about what the UN is now saying. They're appealing to all the countries, all the member states of the UN to call ceasefire around the world, because it is time now to fight COVID-19, which has taken over 18,000 lives. It has affected over 420,000 people around the world. Not one country is right now free from this deadly virus. So to get an understanding of even if there is a remote possibility of seeing a ceasefire, we're going to be speaking to some people who are right now in conflict zones or a part of those countries who need that ceasefire badly. Let me introduce who we have with us. We have with us Dr. Basem Naim. He's joining from Gaza. He's an analyst as well as a spokesperson for Hamas. We also have from Kabul, Afghanistan, Mr. Najib Sharifi, who is a journalist. Welcome to both of you gentlemen to the show. First off, my hope and wishes and prayers in fact, everybody from Newswire, that you and your loved ones are all safe there. I want to start with you, Dr. Basem Naim. There were just recently, a few days ago, reports of confirmed cases coming from Gaza. The UN is now calling for a ceasefire. What are your hopes at this point? Do you think there's a remote possibility?
Thank you very much. First of all, I wish for you, your family, and all our friends and brothers and sisters in Pakistan all good health and safety and security. The situation here on the ground is before the corona pandemic it was very vulnerable and fragile because of the Israeli blockade and siege for more than 14 years. And there was a hard work through the UN and the Egyptians and Qataris to reach a kind of understandings. We cannot talk about a full ceasefire, but a kind of calm. I think this was reached partially, but the situation was before the corona pandemic was very vulnerable and fragile because Israel was not committed to their words to release the humanitarian situation here on the ground. Now, after total closure of the Gaza borders to avoid further positive cases coming into Gaza, after diagnosing 2 cases, unfortunately, they were coming through Pakistan. 2 Palestinians were in Pakistan. The situation is becoming more fragile and more vulnerable and more easy to be broken because the Gaza Strip is one of the most populated area on earth. We are talking about 5,400 citizens per square kilometer. If I hope not, and pray not. If something a corona spread out all over the Gaza Strip, this will be a real humanitarian catastrophe, and it will not be easy to be controlled.
Now, I want to come here, Mr. Sharifi, because the situation in Afghanistan is also very similar. There has been constant political upheaval, and now with the U.S. just recently announcing that they're very disappointed that the strain in the relationship has, as a result, meant that the U.S. has withdrawn $1 billion in aid to Afghanistan at a very critical time.
Yes, it's indeed very unfortunate because on the one hand we have the threat coming from coronavirus to a country which has got probably the weakest health infrastructure and a very, very weak and fragile state. On the other hand, it's the threat of the Taliban and ISIS is very dangerous. As today, we had an incident where ISIS militants stormed a Sikh temple, and
yes.
Based on the news, at least 25 people were killed in the incident. This is taking Afghanistan to a deeper state of turmoil at this stage because threats come from all sides, and it seems that we do not have the necessary leadership and the necessary structures to tackle with them.
Dr. Basem, the concern also is, though, when the UN chief, Antonio Guterres, says these words, and I feel like they'll go down in history one day, that the fury of the virus illustrates the folly of war. What has been in the US is the Israel-Palestinian conflict for so many years. This could have been, or could be the opportunity maybe, that at least tensions could be frozen for a while, so to deal with the pandemic.
First of all, the call of the UN Secretary General is a very strong and very important one at this time. Really, the humanity is in an urgent need to be united to face this very dangerous threat for the humanity, the coronavirus or corona pandemic. But unfortunately, the Israelis, backed up by the Americans, they are continuing their plans. They continue demolishing houses, arresting people, even up to yesterday. Maybe you have seen one of the videos where Israelis with soldiers with masks entering and storming Palestinian houses to arrest new Palestinians and to demolish new houses. The same thing if you talk about Jerusalem. I think the Israelis using this time, the international attention is directed toward facing coronavirus to continue their plans by confiscating more land, building more new units, Jewidization of Jerusalem. This is on one hand. On the other hand, because of the geographical separation between Gaza and Israel, and as you know from the medical point of view that this virus can be conveyed only through direct contact, they are making great burdens in getting in any needs or any help from outside to Gaza to face this catastrophe or this pandemic. We have asked many international bodies to help Gaza because we are really in urgent need for further.
I'm sorry, I'm going to, Dr. Basem, interrupt here. I just want to plug in another sort of sub-question to this, is that when the U.S. has supported Israel throughout and during President Trump's tenure overtly, without any sort of qualms, then when the UN chief appeals to members all across, to the Secretary, to the Security Council, to the General Assembly, does it even matter?
Look, generally, Trump and his administration, they are not respecting this international body, the United Nations, and therefore I don't expect that this appeal from the Secretary General will be heard well in the United States. I don't think that this will be really effective anywhere, especially in the United States.
It just makes the UN looks good, because at the end of the day, it's the US who has veto power in the General Assembly. Coming to you here, Mr. Sharifi, the question is not just about whether it falls on deaf ears or member states, but in Afghanistan, the situation is a little more different. There are terrorists on the ground who wouldn't at all adhere to any calls for ceasefire, whether there's a pandemic or not.
Well, it seems that they don't feel themselves bound to any calls, because these are terrorist groups who basically, by very nature, they don't feel themselves abiding by any rules. And on the other hand, we have this threat, like very dangerous threat of corona, that's threatening almost 30 million population. So the situation is extremely worrying and complex here in Afghanistan, because it seems that in the midst of this crisis, the further threats will be coming from terrorist groups, as we witnessed one very fatal incident today, which is adding to the complexity of the situation.
It's complexity of the situation, but also in terms of the kind of importance that Afghanistan had in terms of the US, Taliban, the conversation going on, the withdrawal. It's suddenly taken a back seat. Will this backseat to the pandemic, will this affect the kind of progress it was making on that front?
Really have an effect, because as we're seeing in Kabul right now, many offices are kind of like almost dysfunctional, because people stay at home and we do not have the necessary infrastructure to continue the operation while people are staying at home, the things that we have in the Western countries. So if the government machinery and at the same time all other organizations that are working on this, if they do not function properly, this will inflict significant delays on the whole peace process.
Now, on the peace process and the importance of it, let me welcome another voice here. We have with us Fadel Abdul, an analyst and the chairman and founder of the Syria Network for Human Rights. He is joining us from Doha. Syria has been in conflict for most of these 9 years, these past 9 years, in fact, more than 9 years. And the toll it's taken on the civilians, on the Syrians, is horrible. This call for ceasefire, do you see it having any effect?
Actually, we hope so. And we hope that ceasefire is held even in this virus suppression and after as well. We request for ceasefire long time ago for the like the relief of mainly of the IDP. The IDP situation is the perfect circumstances to this virus to be spread in between. Till now, actually, there is comparing with the previous period, the ceasefire is held even before the announcement of the General Secretary. But actually, the General Secretary request, and then it's being followed actually by the Syria Special Envoy. I think this essential request by both of them to the party and mainly to the Russian and the regime. Because why I'm talking mainly for both of those sides, because we noticed, like always, no care about the civilians' life from those sides. And beside that, yesterday the civil defense foreign ministry, the civil defense ministry, the Russian defense ministry visited Syria and meet with Bashar al-Assad, and we afraid that there was a plan for the next waging of war against civilians in Idlib. So that's in that context, the call from the Antonio Guterres, Mr. Guterres, and Syria Special Envoy is key in this regard, actually.
But Mr. Abdul Ghany, let me ask you this, that in Syria, there have been hundreds of thousands who have been displaced time and again. And right now, Europe has been, before the COVID took their attention, had been very concerned that Turkey is allowing these refugees to move into Europe. That in itself creates more of a risk of a spread. So why would it be now that the UN would get everybody to listen on a ceasefire to prevent all of this?
Actually, now, the border is being closed like 2 weeks ago completely, the Syrian and the Turkish border, which is good for both sides, actually. And as I mentioned, now there is no movement for the refugees at all. But the thing is, we are talking about disaster circumstances for those IDP, mainly for the random IDP camps, which there is lack of water and lack of the cleaning material. That's our main concern, that COVID-19 spread very widely in this area, and if it's spread in Idlib, then this will affect the other territory in Syria and in the region as well.
I understand what you're saying there, but there are, of course, big concerns whether those who are supporting Bashar al-Assad, Russia, and then on the other side, Turkey, will ever come to an agreement over this because of the expense of the refugees.
I think that there is negotiation now taking place in this regard, and that's why I referred to the visit of the Russian
Defense Ministry. But the UN has historically never been able to hold these powers that be accountable, leave alone get those who have veto powers to see their perspective. Why would Russia agree?
I think that the COVID-19 is behind than the Russia thought. This actually shocked everyone and affected the ability and the capacity of the Syria army and the Syria regime as well to do or achieve any movement. Even Russia, and even economically, it's heavily affected. So that I think they will hold for this area. But you are totally right, and I'm totally agree that after this this dilemma being solved, COVID-19, this disease, I think they will continue their waging attacks against civilians and seize more territory and keep pressuring Turkey until they have this decisive win. So at this period, they just manage the time and how they deal with this.
They're also calling for lifting of sanctions to countries that have been hit by COVID-19, which is pretty much every country on the planet has been hit by COVID-19, but countries specifically suffering are like Iran. Gaza itself has been facing a lot of blockade, Dr. Basem, Naim, for years now, and its economy is in tatters. Do you feel there's hope that at this point, for medical aid, those blockades could be removed?
Yes, this is true that the situation in Gaza, as I said, very vulnerable at the economical level because of now more than 14 years of Israeli blockade. But unfortunately, we have contacted many international bodies to help Gaza. The only positive response announced until now was from the Qatari government, where they have talked about financial support for Gaza to cope with the COVID-19 epidemic. Otherwise, we have faced the first problem, the Israeli tactics of delaying and, as always, trying to block everything which can ease the life of Gazans. Second, we have, as you know, the internal problem, the internal division between Gaza and Ramallah, and the international aid have to come through the official channel in Ramallah, and we have no objection against this. We are fully agree with this, but we are asking to keep the percentage or the part of for Gaza is for Gaza, and not to keep it in the West Bank.
We've run out of time here, though, for speaking to us and giving us your viewpoint. Mr. Fadel, Abdul Ghany, Mr. Najib, Sharifi, thank you so much for joining us. We've run out of time. The UN chief has called for all countries to hold ceasefire in all corners of the world. One can only hope in these difficult times that this voice will be heeded. Till next time, goodbye and stay safe.